Nidham, your host. Welcome back. I have a question for you. Have you ever thought about what if post-COVID symptoms like depression, anxiety, brain fog, and weight gain weren't psychological, but biochemical? My guest today is incredible. Dr. Cynthia Keller is seeing a pattern that most clinicians are missing: specific nutrient and neurotransmitter depletion that's reshaping mood, metabolism, and recovery. And the wild part? With the right patients, she's reversing it in weeks, not months. I'm telling you guys, this is a crazy episode filled with clinical pearls, clinical examples. And I want to say that if you are listening to this and you're like, hey, that's me, or that's someone that I know, a friend, a family, she's giving a very generous offer to the listeners of this podcast. All you have to do is go to Alchemic Medicinals, ALCHEMIC medicinals.com, and use code NATROCKS at checkout. You'll get a whopping 50% off the tryptophan regenesis powder while supplies last. Doesn't include capsules. But guys, I'm not telling you to go buy this stuff. You got to listen to the episode first. See if you think this is something that might help you or someone you love, and then go shopping. Okay? This is not just about the shopping. Now, this episode is brought to you by a couple of amazing brands. First is Oslo Sleep Earbuds. Really fabulous product if you've got a noise issue in your surroundings while you're sleeping, or if you need help unwinding. Also, Youth Daily by Young Goose. You guys know that's one of my favorite face creams. Beautiful technology built into it. And new Mito Pure Gummies. We all know how much Nat loves gummies, and these are urolithin gummies. All of these guys have special offers just for you. Check out the show notes below for details. And now, enjoy the show. Welcome to the show, Dr. Cynthia Keller. This is going to be nothing short of an epic conversation. Thank you for taking the time out of your very busy life to be here.
Yeah, it's my pleasure. Like I said, I'm super excited.
This is also the craziest time of year on top of everything. So anyway, this is fantastic. So let's just jump in.
Okay.
You know, basically the moment you stop believing that standard care is enough. So was there a first patient or family member that made you think because you're a conventionally trained physician way back in the day.
Right.
But was there an event, a person, a patient, something that made you stop and say, I can't keep doing this. There's got to be a better way?
I truly think that my my superpower in medicine is probably care and presence and holding space. And that's something I did before I was a physician. I think maybe I became a physician so people would listen to me. Like I distinctly remember being younger and saying to parents, or thinking to parents like, oh, you should be loving to your children and you should care for them in this way. No one listened to me. I became a pediatrician. Everyone's like, what a great idea. So, I think maybe I didn't change, but I got to wear the robe of a physician where people then listened to me. But the way I sort of got into, these other sort of non-traditional realms is that I would have a patient, like for instance, I treat Lyme, but I'm not a Lyme specialist. I'm a patient specialist, right? Mm-hmm. So if a patient ends up with something I can't solve, I'm going to solve it. And it started with GI, that sort of, I was super well trained at a children's hospital. I was like, ready to code and save lives and intubate. And then I got into general peds and I was like, wow, there's no one to save. And,
but there is,
right. And, I'd have a kid with GI pain, let's say. And so I would work them up. But I had none of these tools, right? I didn't really understand. No one did. I'd send them to the GI specialist who would biopsy them. It would be fine. And they'd send them back to me and say this kid's good to go. But the kid wasn't in school. So the kid wasn't good to go. So then I had to solve it, right? And at the time, that was more like integrative medicine, and then early on it became sort of functional medicine, but this didn't exist yet. But then after I figured that out, I had that tool in my toolbox. So the next kid that looked like that, I could do it. And then when the kid after that didn't get solved with that, I went and solved that. So I think, so much of what I do today might be even, standard of care for one of the kind of physicians you and I know, but, it didn't exist before that.
Yeah, so it sounds to me like it was organic for you. It's because of who you are and how you're wired.
Yes.
Right? Another physician might have said, okay, well, the GI guy said you're fine.
We're good.
As far as I can tell, you're fine.
Yeah.
So maybe let's send you over to psych and see if there's something wrong with your child. Maybe it's all in their head, which is still from a place of caring, but passing the buck, saying doesn't fit in my box, didn't fit in his box. Let's go find another box. Whereas you're sitting there saying, well, there's clearly something wrong with this kid. What else should I be looking at? Which is, I think I'm hoping that these days is becoming a little bit more common, but I'm sure that at the time you were bucking the trend. I can't imagine that the physicians around you were saying, go sin.
No, it was super uncomfortable.
It was like, what are you doing? You're wasting your time.
Well, no, it's worse than that, right? It's worse than wasting your time. They think you're crazy and going to hurt someone. I'm still on staff at my children's hospital, my local hospital. But the more interesting, actually like problem solving things I did, the more I think I made everyone nervous. And I actually started out of residency in a really neat, small general peds practice that was private, like done really right. But I had two partners, and about 11 years ago, it got so uncomfortable. And like the thing that pushed her over the edge was I had a book that said transdermal magnesium on it, which I don't know why she thought that was the scariest thing ever. And that was like her tipping point. And so I thought, I have to do this different. It has to be just me. And that's 11 years ago, we opened this clinic.
Wow.
For that reason, because
magnesium. Out of all the crazy things you could have brought in, I'm slightly shocked.
Well, I mean, but I was already doing neurofeedback in the clinic. I mean, there was a lot of weirder stuff I was doing. Yeah. She saw that book and she's like, I don't know what she thought I was. I really don't know what she thought that meant, but
it was a bad thing. And frankly, it led you to where you are today. Yeah. So overall, it's a good thing.
Yeah.
So in pediatrics, you're really watching development in real time. I mean, that's the nature of pediatrics. What did that teach you about how chronic disease gets built years before it shows up? Like this narrative that nobody wakes up one morning diabetic. Nobody wakes up one morning with cardiovascular disease.
That's a really interesting question, actually. So thanks. Because I love kids and I love watching them evolve. It's part of what got me really passionate about the gut. So it's so clear to me that the gut is so important for, I mean, I know everyone says that now and it's not, but like actually, right? Like that's not just because it's sexy
We're not
to
just
say.
paying lip service.
No, like this is like a real thing because, think about it. It's self, not self, like the GI system, we need to accept food, but we need to reject toxins or, we need to allow self and our happy microbes, but we need to not, then mount an immune response to the guys we don't want. And really it is like who we are is determined by that interface, right? Who am I? Who do I allow? Who do I fight? And if that goes wrong, I think that probably is the nidus, even more than genetics. And then the other thing I'll say is that really good parenting matters. And I love parents and I love kids. And it's been like a true honor. I now have kids of kids I raised. Does that make sense? And, and like recently, one of my nurses who didn't know the parent when she was little, but watch her parent now, she's got 2 kids. And she said, even if I hadn't told her that had been my patient, that listening to her parent, that she knew it was mine, just like the way that she parented. I know it makes me want to cry.
Yeah, that's like a legacy right there.
Yeah, I planted seeds, didn't I?
You did.
And
that took root.
Yes, right. Yes. No, it's true. Like I truly am the luckiest human I know. I'm so rich in that. Yeah. And I mean, you didn't ask this, but just like the reason I picked peds, I knew even when I was 6, I don't know how, but people said I was going to be a doc and I was going to help kids. I think it wasn't really like popular when I would tell parents what they were doing wrong when I was very small with their children. But like I said, once I became a doc, everyone was like, oh, that's a great idea. But so I felt like, there's been sort of an evolution of kids, sort of the spirited kid that arrived maybe like in the 90s. And I felt strong that my job was to way-show the parents, not to squelch them, because, and that has been an honor. And the reason I mentioned all that to your question is I think we also underestimate the importance of the emotional component, the joy component, like, and even like the positive thinking. I mean, like, it's not just positive thinking, right? I can create different biochemistry with thought. Yeah. I can think like good things, and my heart, variability will change, and that changes the chemicals that are released. So like, it's the power you have to just like love someone and have that change their life and their health is profound. And all of us can do that, right? Everyone. Yeah.
Hey folks, I just wanted to throw a little message in here for those of you who are sending me all these incredible questions on social media or through YouTube or even on Spotify, wherever you're listening to the podcast. I wish I could get back to you, each one of you personally, but unfortunately I can't. And because I cannot, I created about a couple of years ago now, I created a membership community where I get to hang out with people just like you. I do live weekly Q&As, almost weekly anyway. We also do have podcast guests come in to answer everybody's questions and do presentations. You get to interact live with those podcast guests. We will sometimes do challenges with some of the partners. Like in 2026, we have a mitochondrial enhancement challenge coming up where we're going to be testing mitochondrial function. We're going to be testing people's deuterium levels. If you haven't heard about deuterium, we've got podcasts coming down the pipes on that. And then people will be invited to follow a personalized protocol and then retest their mitochondria on the other side. We offer that in the membership community, and we do it at incredible discounts that you just can't find anywhere else. So if you're interested in hanging out with me and other like-minded people, which actually happen to include some pretty awesome practitioners and even some previous podcast guests who've come and joined the community, then I invite you to check it out on my website, natnidham.com/the-longevity-community, or just go to natnidham.com and look for the longevity community tab at the top of the page. Click on that and see if this is right for you. I would love to see you there. And we could make 2026 our best year ever together. So once again, that's natnidham.com. Just look for the longevity community tab at the top of the page. Now let's get back to the show. The next question I was going to ask was about when did you realize relationship is not a nice to have, but a clinical lever? And it sounds like this has been a part of you forever.
Did
it come from your mom and dad? Were you raised that way? Like, do you think somehow your childhood fed this? And maybe you don't have to go into big detail if it's a big question, but one way or the other, either through adoption or knowing that things needed to be different, and you don't have to go into detail.
So I had a really uneasy childhood, and both in the home and out of the home, and I remember thinking, oh, these adults, man, like a therapist told me later that I walked into the office when I was like, 10 and said, okay, here's the problem. This is what's going on with this. And like, this needs to change. And she thought I was weird. And later I still saw her when I was like 18. And she said, you were so right. So I think I have compassion, even like I can truly forgive. I think everyone always does the best they can. And I'm resilient. I do think it shaped me, but I think maybe like love is my superpower. Just like,
I think you came into this world wired to do what you do.
Yeah.
Honestly. Yeah. And we have far bigger topics for the audience to talk about today, but that's just from speaking with you and having this conversation. Yeah. It sounds to me that you're here for this, and that's what this is all about for you. So, all right. So your clinic is called, your concierge whole family multidisciplinary clinic is called Centered in Wellness.
That's right.
Which is a beautiful name.
Thanks.
What does that structure allow you to do that a normal primary care visit simply can't?
Yes. So it was started because at my old practice, we used to spend an hour with each patient, which was like, you understand, like pediatricians don't get to do that normally. And with the changes in insurance from, like 99 to 2010, that just got harder and harder and we couldn't stay afloat. So it became clear to me. And then also the transdermal magnesium thing. But
God forbid.
I know. It occurred,
by the way, it works really well. Anyway.
I know. Better, actually. Yeah.
It's amazing.
It's so crazy. So I realized I was either going to have to do medicine differently, or I was going to have to either change the model, or I was going to need to change what I wanted to do in the room. And I can't work for anyone. Obviously, no. Right?
No.
I would be uncontrollable.
Thermal magnesium.
Right. No, because even that I was a partner, and still. So then me and 5 of my friends here that, my employees that I've worked with, one for 21 years, one for 14 years, one for 15 years. This is my mission is their mission. This is it. And so we thought, well, maybe we could try a concierge thing. This is in 2013, 2014, which is not a thing, right?
Not a thing at all.
Not a thing.
No.
But I thought, well, I wonder what will happen. And we contacted some companies and they said, you can't do that. You're a pediatric office. You can't do that. And we were like, well, let's see what happens. So we closed the other clinic and we said, well, we'll open up. And it was 3 months. It was the best 3 months of my life because we created everything. And I felt like maybe we were going to throw a party and no one would show up. This is a whole new idea because we bill to know us and then we bill insurance. So people pay kind of like a co-op, right? In order, if you want this kind of medicine, I buy machines that are $60,000 that I'll never get paid off in the use of them, but our patients need them. So people sort of, that's it, right? And so on day 31, we filled up. Day 31. Yeah. And we've we stopped counting at 200. We've had a wait list forever but also patients don't go, right? Because so it started.
They don't leave.
That's exactly what I mean.
Yeah. Yeah.
So, and it's really fun, but now I get to do whatever I want. So, the visits are an hour, and over the years, now I have 5 naturopaths that work for me, and I was a pediatrician, but then we started to get to bioidentical or, menopause, or my parents were getting to menopause. So I thought, well, I better figure that out. So that's when I went to A4M in 2012 or whatever. And so it's just sort of evolved. So I think what it allows me is to do whatever the heck I want, which is whatever the heck I need for the patient sitting in front of me.
Yeah, that's amazing. All right. So it sounds like I don't know that we could define your zone of genius necessarily, but one of the things one of the areas that you've really been talking about has been this post-COVID area and the idea of stolen nutrients. Yeah. Right. So you've said that COVID can steal or drain specific nutrients, and that replacing what's missing can change an outcome. Just doing that, which is really interesting, right? Can you walk us through that? What's being depleted and how does that how does that show up in symptoms?
Yeah, well, I couldn't be more excited because this is I get so crazy excited about this because the body heals. If you just get out of the way, right? And we have to give it what you need. So I'm a pattern recognition expert because I'm a pediatrician. So you said, there's developmental phases, there's growth charts. And so I can see really quickly when something is an outlier. And then if I see repetitive outliers, now I have a pattern, right? Mm-hmm. And then I have to solve it because that's what I do. So what happened is we worked through COVID and our patients, we took good care of them and that was fine. But then it started, I had a patient who was suicidal. And I've known her since birth. She wasn't supposed to be suicidal. She should have been panicked, right? Because that's who she is. And I was like, well, when did this start? Because I was so confused. And usually I've intervened before they're suicidal,
mm-hmm. Well, there have been signs and symptoms.
Right. We talk about that, right? And we find solutions. So she said August 25th. And I was like, what?
Whoa.
And she said, I was at the fair and I realized if I can't be happy here, then I might as well just end it. And her life was great. There was no thing. Later, I figured out that she had COVID. I think it was August 18th. Then I went, well, that's weird, right? So for it was almost a year, maybe 9 months. I treated her with medication after medication because I'm good at that too. I I don't love medication, but I really don't like kids who are suicidal. So it's always about picking the best choice. And then I was at a conference and I hadn't solved it. Like, she wasn't actively suicidal, but she wasn't happy. I still was seeing her regularly. And because I had to solve it, right? So then I'm at a conference and it was about COVID, but it was about how COVID hits this, or there's 3 receptors for COVID in the gut. And that cell is called the enterochromaffin cell. And its job is to take tryptophan and turn it into serotonin in the gut, not in the brain, to like move things along, propulsion, so that the virus leaves and some other things. And all of a sudden I thought, and then I thought, well, maybe this is a serotonin thing. Maybe that's what's up with her. And then I went, but like 90 to 95% of the serotonin in the body is made by those cells in the gut. So then I'm like, oh, this is it. And then I remembered, wait. Like, serotonin doesn't get into the brain, right? Like, tryptophan has to get into the brain. So you take tryptophan in, about 1% of that gets into the brain, and that you can use to make serotonin for the brain, for moods. Right. So then I was like, well, if COVID keeps removing it, right, then like maybe 1% of less tryptophan is less tryptophan, right? So what I love about my office is it's me and a bunch of people, and my front staff is as smart as everybody. Like, we sit at lunch for an hour, and we talk about cases, or I teach. So I throw this out there. I'm like, do you guys let's brainstorm this? And one of my naturopaths, who's so smart, he said, well, Cynthia, could we just like give her some tryptophan? I was like, I don't know why that didn't seem so obvious. I gave it to her. I saw her back 2 weeks later. You know what she said? I think this has just been a really great learning experience. I was like, what? So I removed all her meds, and she went back to life. And I thought, well, that's remarkable. So then I started digging deeper and deeper. And then I started talking about it. And then later, a patient came, well, actually it was her. She came back and she just wasn't joyful. This is like maybe 9-12 months later. And I was thinking, well, if I was going to prescribe for you, I would try to tickle your dopamine. Like, I'd probably give you Wellbutrin, which works on dopamine. But I wasn't going to give her meds because I'd been through that before. And so then I went to my group at lunch, and I said, you guys, like, now she's not making dopamine. And I was like, does tryptophan? No, because tryptophan goes into serotonin, but tyrosine goes into epinephrine, norepinephrine, and dopamine. So I'm like sitting at lunch, and one of my naturopaths says, just a second, runs into her room, comes out like 3 minutes later, and shows for me the 3 cofactors that are shared in those 2 pathways. And I went, oh my gosh. And they are P5P, which is a active form of B6. I'm sorry, BH4. That's what I meant. Sorry. Which is it's involved in methylation, and then also zinc. And it's very, very expensive to give someone BH4. So instead, I cheat in and give methylfolate just to support the methylation. So that's my cheat. So I'm going to say from here on that they need folate, but it needs to be methyl. But really, it's BH4, but I'm cheating the best I can. So, and it works. So that's fine. And it's cheap, right? It's not like $100,000 a year or whatever. Right. So I gave her P5P, zinc, and methylfolate, and her joy came back. And so I think what happened is that enterochromaffin cell is being stimulated by COVID all the time. So, and I mean, if we have time later, we can talk about how it incorporates ourselves, about how COVID incorporates itself into our microbiome. But otherwise, it's just true. And, every time you go to Safeway, it gets spit on you. And even if you don't catch it, right, it hits those cells and you expulse it. So there was this repetitive drain. It doesn't have to be a big COVID event, right? It probably was.
You're talking about the spike proteins getting embedded in the spike proteins getting embedded, or the actual virus?
The actual virus.
Wow. Okay.
But also the spike proteins.
Is it like a latent virus, like a Lyme or an EBV? Is that a little bit what you're saying?
Right. So first, with the enterochromaffin cell, it has 3 receptors for COVID. Now, okay. So it can also be probably stimulated just by the spike protein, but Right now I was talking about COVID. But to answer your acute question is that the problem with COVID is it can do a bunch of things. So it can either incorporate itself, infect our microbiome. So, Robin Rose, right?
Yeah.
So, I mean, when I first heard her talk about the fact that it's a bacteriophage, which means that, it's supposed to infect me. And then I'm supposed to decide if I want to kill that cell that has it in it or what, or fight or whatever. But if it's in my microbiome, well, that's self. Right. I have allowed those. So this is like catastrophic on a level that, I mean, we could talk about for 2 hours. And I cried for a whole weekend when I realized she was right, because I thought that that's it. We should just burn it and start over, actually. And so it can do that anyway, that's on a happier note. And it can also, our immune system can keep showing the spike protein. And also, I mean, it just goes on and on about it can live in the gut, not even in your microbiome. We have to get Robin Rose and you to play because she has so much to talk about that.
Okay, so basically what you've realized, and with the help of your community, really, because this is, there were a group of you presenting last September on this topic. And what I think is so phenomenal is there's all these, we're not necessarily talking about major medical conferences here. We're talking about sidebar events being put on by people like Leonard.
Yes.
Right?
Yes.
Who from New Bio Age,
yes.
who's like, this is a conversation that needs to happen.
Yes.
We don't have time for A4M to get with the program.
Yes.
So I'm going to bring together the 4 women that I know who are at the forefront, and we're going to jam on stage about this, which I think is so, this is how we make progress.
Yes.
And it's a lot of what you're talking about.
Yes.
You're brilliant and you have a staff that you can sit and play with and throw things at a whiteboard and say, oh, this is what's going on.
Right.
It's remarkable. So, and so what we're saying here, and it's so funny because I had this conversation on another podcast recently with someone, and I've said, it's like the world is now BC and AC. It's before COVID and after COVID.
No, that's totally
seriously, it has redefined our world, and whether we want to admit it or not admit it, this is not just another virus. This is a virus that has redefined human health. And what the challenge is now is the challenge that you and your colleagues have taken on is, okay, it's here, not going anywhere.
Right.
What's it doing and how do we mitigate it?
Yes. And I mean, you could not be more right about how it's changed things, and it will not go back. No,
doesn't sound like it.
If it's incorporated, I like to say that my pronouns really should be we and us, me and my microbes. Yeah. Right.
Well, everybody should be.
Yes. Right. So, but now it's me and us and COVID.
Them.
Right.
Yeah. And
probably forever. And so that creates a constant, cytokine, cascade, both in the gut and in the body and in the brain. And that's why it has completely changed the landscape. And it is why I cried for a weekend. I actually thought, well, okay. But then I put my big girl pants on.
You put your,
and went
you put on your big girl panties and you said, okay, what are we going to do about this?
But
so,
Can I just say about Leonard, this was really neat because, the people who put this on. So, we had this idea that this was a big deal, and it was not a very big conference. I think he had a hard time even getting a hotel to allow us to be there and talk about this, is what I heard. Because to my knowledge, there hadn't been a COVID discussion yet. And we weren't talking about COVID the way everyone else is talking about COVID. Betsy was talking about what it does to the mitochondria. Abid was talking about what it does to the vasculature. Robin Rose was talking about the research she's done on the spike protein and all this stuff. It's amazing. And Suzanne was talking about what it's done to the autonomic nervous system. And and that's not popular. It's also not known. It's also completely overwhelming. And the people who came really liked it. But for the amount of work let's say that I just put into the slides for that. Like I had said to you earlier, it's the thing one of the things I'm most proud of is like the effort I put into that. And it has to start somewhere. And Leonard said, let's start it here. Right.
Yeah. And it will, from there, it will gain traction and amplitude. Right. Yeah. And maybe this conversation gets it to the next, somebody will hear this and say, I want to host this conversation next on a different stage, in a different way. To answer the first question, the depletion of nutrients that you're seeing are, on the one hand, the tryptophan, but in a bigger level, those three precursor molecules that are required as cofactors to make both serotonin and dopamine. And those are, just to recap, we can cheat with methylfolate instead of BH4. Yeah. P5P, which is a form of B6, and the third one, zinc. Yeah. Zinc, which is really interesting because zinc got a ton of attention. Yeah. Right, because of course we all know if we get sick, we need zinc. What the thesis is, or the hypothesis, is that those three in particular become depleted by the virus.
Right. So like in short, I'll just recap that a little bit different, is that this enterochromaffin cell has three receptors for COVID. So more than anything else, it grabs it. It uses tryptophan and a bunch of cofactors to make serotonin. But for these kids with the mood thing, and this is why it gets bigger and bigger, first it was that they didn't have enough tryptophan to make serotonin. Next, it was because these three cofactors were shared between tryptophan to serotonin and tyrosine to the catecholamines, then we couldn't make catecholamines. But a whole host of nutrients are being depleted. It's just that I'm picking one thing at a time. And so it got bigger and bigger. Like at the beginning, it was really, with the first round of COVID or the second round of COVID or the third round of COVID. Yeah. It was the tryptophan we were noticing most. And then it was like probably the next bigger ones, which was those three that you said. But then it actually became bigger and bigger. And it's really all of the nutrients that are being used, so then calcium is in, just like a whole bunch of them. And I love biochemistry. So, and my mind is crazy. So you should see, I actually kept sort of almost framed my thinking about this because there's like little scribbles everywhere as I figured it out. And now I know that everything needs to be repleted, but you can like save someone from like severe mood changes or little mood changes. We've probably treated, just like over the phone, like go get some tryptophan kind of thing. Probably 200 people in our clinic. Oh my gosh, probably more, because the mom will call and say the kid is depressed. We say, well, like before you come in, do me a favor, do this for 3 days and call me. And then we say, well, and like, could you do it too? And she, we'll get the response that I think you saved my marriage. I thought my husband was irritating. But it turns out, it turns out I didn't have any serotonin. And, and it's like, there's so much going on in the world right now that I wonder, how much of it could just be a nutritional deficiency that you can replete for not very much money. Like, I think you can even get L-tryptophan at like Safeway.
So 2 questions is, do you think some people are more susceptible than others?
Absolutely.
Because at this point, I think you'd be hard pressed to find any human that, unless they were living a very isolated life in some far-flung reaches of the planet, that wasn't somehow touched by this. Oh, whether they got the virus or they were exposed to it and were asymptomatic or were inoculated, whatever. Like, it's just like it's
ubiquitous.
It's ubiquitous. That's the word I'm looking for. And so, but yet some people seem to be more susceptible than others. And maybe that just depends on factors we have yet to identify.
Right.
And personal weaknesses.
Right. And I agree, sort of like with chronic Lyme, why are some people bit by ticks and it doesn't happen and some do? It's about the immune system, I think, maybe fighting it. But it doesn't matter whether or not you are having big cases, right? Like I like to say, poor Safeway, I always pick on Safeway, but like you go to Safeway, someone spits on you, even if you don't get COVID, if they spit COVID into you, probably it was that enterochromaffin cell that grabbed it, right? Why do we have peristalsis in response to viruses. This is on purpose. Our body is so smart, right? So that creation of serotonin creates peristalsis. Why do we vomit and have diarrhea in response to viruses? It's to expulse it. So even if you don't catch it, you're doing that, right? And it educates the immune system. It modulates the autonomic nervous system, all in the enteric system. So I don't even care if you catch it. You are being drained. For some people, let's say it's incorporated into their microbiome, so the draining is going much faster or it's continuous. And then, like some people don't methylate as well. So there are then like other components. But I think this touches everyone, to your point. I think like clearly COVID is ubiquitous. It's also not going anywhere. You get it. You're exposed every day, even if you don't know it. And it's draining us.
Yeah. Okay. So what are the 3 to 5 patient patterns that make you suspect that this post-COVID nutrient depletion is happening even before you see the labs?
Yeah. In fact, I don't test labs for this. You
don't even bother with labs.
No, it's so easy.
Nutrient deficiencies. Yeah. All right. So what are the patterns you're looking for?
So one is a mood change. So, someone will say, like, my sister called and I said, when I was figuring this out, right? Like, oh, Michelle, can you go get some tryptophan? Because I think maybe you might need it, soon. And she said, well, why? And I said, well, have you been sad? And she said, well, yeah, because my daughter just moved away to college, and actually it was graduate school, but, no, it was college because this was several years ago. And so that's why I'm crying. And I said, well, like, will you indulge me? Will you take it? She calls me back. She was like, what the heck did you just give me? Right. It's tryptophan. Right. So one is mood changes. It doesn't have to be suicidality. It can be irritability. Right. So it sort of feels like being on your period, how like everything is, you have like one nerve, and like everyone's just a little bit on it.
I mean, open up Instagram and the memes of women doing the most hilarious things.
Yeah, I've seen them.
Haven't you seen them? And I relate to a lot of them, right? Like the sound of chewing or
right.
But I think the takeaway from that is, first of all, the memes are hilarious. We relate to them. Yeah. But it's the difference between, like your sister, it's the difference between sitting and crying, inconsolably because your daughter has gone through a rite of passage that frankly, another parent with a different child would give the right arm for, versus celebrating the fact that she's moved on and feeling sad at the loss because knowing that, having her near you is never, you know what I mean? Like it's almost like there's an appropriate sadness to when our children grow up.
Yes.
And when you're on your knees weeping uncontrollably, going, I just shouldn't be crying like that shouldn't be this bad,
right?
Kind of thing.
Well, and so I just have to say about Michelle, my sister, just in case she sees this, she was doing it appropriately, meaning that she was. I just don't want to judge the right. Yeah. Just
Michelle, no harm intended. Nobody else knows who you are.
She's amazing. Yeah. But yes, to your point, it's about an appropriate or like a reasonable response. Is this like an unexpectedly large response?
Okay. So mood.
One. Second one, oh my gosh, it's inappropriate weight gain. And I do not know why I cannot fully express this to adult people, but I will tell you, kids follow a pattern. I'm a pattern recognition expert. I teach my parents how to feed their kids from birth with the mantra of, the parent offers healthy food choices. The child decides what they need. I make sure they grow well. So I don't have kids who have growth problems, right? So, and if you look at the BMI on a kid at about age 2, it's here. They're all, right? About 5 to 6, it reaches a low point. And then they start to fill out at 8. Every child from 2 drops their BMI. That's just it. If you think about
they lose the little puffy hands and the puffy feet. It's very sad.
Yes. So I had 4 back-to-back 3-year-olds who at their well child check, their BMI went like that. And I was
vertically up
in a row. And I thought, okay, so in 25 years, this hasn't happened. Why now? It's probably COVID. And I was already playing with the nutrients. So I thought to myself, and I went to my, my lunch meeting and I said, okay, you guys, what creates, because they weren't changing their eating, right? Mm-hmm. Like a 3-year-old doesn't suddenly, you have to chase them around anyway. They're not suddenly like, I'm going to like overeat That's not how that works. They got other stuff to do. So, so I said, like, let me think. So what creates inappropriate weight loss, right? So I was trying to think it through. I was like cocaine, fen, things like that, right? By inappropriate, I mean not related to calories.
Right.
Right. So, so then I look, it's catecholamines, right? You require catecholamines, epinephrine, norepinephrine, to take glucose up into the muscle via a transporter called GLUT4. Mm-hmm. If you do not have catecholamines, then you cannot take glucose up, and you will have too much glucose. And guess what your body will do? It will store it directly as fat. It doesn't matter. And why would you not have catecholamines in this COVID phase? Well, because you're missing.
You become depleted.
That's right. In those three, right?
Yeah.
So I gave it to them, and oh my gosh, I have chills even telling you now. Those kids, I didn't talk to them about eating because that's not part of my mantra, right?
Well, as a 3-year-old, good luck with that.
Right, exactly. And I didn't talk about weight in a way they could understand it either, right? And all of them came down on their own back to their native curve within a few months. And okay, the first kid put on, it was like, what was it? It was 25% of her body weight in like 9 months. Let me say, it was like, I didn't even know you could do that. She went from 40 to 50 pounds. She was like, I think she was like 2.5 at the time in like 6 to 9 months. I don't even know how you do that. Right.
That's
and
a lot.
What's really interesting is that after, at first they're not eating more. And this is true about everyone, the GLUT4 thing just isn't working. But then after a while they get leptin resistant and now they are voraciously hungry. And so like a year into it, when I figured it out about this one girl who had kept gaining weight, which I couldn't understand. I was blaming grandma because I was sure it was grandma's fault.
Just sliding her snacks.
Yeah. Because she was also the childcare provider. I kept calling grandma in and so
those chicken McNuggets.
That's right. Right. But she would as soon as she was done with dinner, she would ask for another breast of chicken and broccoli and whatever. And her parents were like, what the heck? So that's weird. Like as soon as they finish a meal, they ask for another meal.
Insatiable.
That's right. And adults will tell me, so in adults, we call it sugar craving. And I have done this in adults now too, right? If they're gaining weight inappropriately, meaning they're like, I put on 20 pounds in the last, 6 months and I'm hardly eating. I give them the nutrients. And if it was due to this depletion, often it is, they will start to come back down. Now kids will do it super fast. Like those kids dropped back to their curve in maybe 3 months. It started immediately, but then they were back on their curve. In adults, I think it takes about twice as long as how they got there. Does that make sense?
Okay.
Yeah. But the sugar craving will go away immediately, like on day 1 or 2. It's really amazing. Mm-hmm.
And so, okay. Wow. I have so many questions about that, but I want to keep us going.
Yeah.
Okay.
So that's 2. The third one is, kids were, peeing too much and drinking too much. And that is type 1 diabetes this is a medical emergency in pediatrics. You have about 2 weeks before they're in the ICU with DKA. So, I thought, oh my gosh, I was checking everyone's urine and there wasn't glucose in it. So that didn't make sense. I was checking their blood sugar. And then I realized it was the same kids who had done that. Zinc. So I figured out zinc. So then I'm like, okay, there must be something here. But the antidiuretic hormone made in the brain that goes to the kidneys, it says don't pee everything out. Zinc is the rate limiting step. So I give them 1 dose of zinc over. So,
and that was enough to replete them.
Yes. Because we're not talking about this isn't like an overabundance. We just need to not be deficient.
Yeah.
Right.
Yeah. Okay.
So that would be 3. And then, then they get smaller. Like some people have mast cell issues because more than they would normally, because you need some of these nutrients that are that are used from tryptophan to serotonin to stabilize mast cells or to break down histamine or things like that. And so, but I would say the big ones that people should think about is if you're upset or you're having mood issues, or if you think everyone around you is irritating, because that's often the same thing. It doesn't feel like you.
Yeah.
Or if you're not happy, because that's the dopamine thing. Or if you're suddenly voraciously craving sugar, or you're gaining weight that didn't make sense. And it's not normal weight. Like, it's weird weight. It's just fat, right? So it's like in weird places. So your body changes too. So that would be the second. And the third one would be, I usually ask them, just sort of for a confirmation, do you find you're thirstier than usual, or you're peeing more often than usual?
Wow. But that's fascinating, because those can be all conflated with other things. Like,
totally.
Any woman in perimenopause, premenopause is, or frankly, premenstrual.
Right.
Like, does it show up in men the same way?
Yes, totally.
Yeah. Because for guys, it would be easier, because guys guys are men. They're not typically that moody. They're fine, right?
Maybe we know different men. I don't know.
I don't know. My guys are pretty steady.
Yeah. Mine too, actually. Yeah. But I think that men don't talk about their feelings. I think maybe that's what you mean. Right.
That's true.
So
that's true.
And so in some ways, like if you notice they were down, you might notice, but in some ways they don't talk about it. I have to actually ask them.
Yeah, and they're fighting it.
Yeah. What actually just happens is usually the kid and the mom are in. Because that's the other thing. It's not just my staff, right? My patients are in this with me. I'm like, let's try this thing. I educate them, and then they call back and they tell me. So we make the mom and the kid do it, and they're like, oh yeah, it's life changing. And then we're like, we're just going to put it in the center of the table. We're not going to tell dad why he has to take it. We're just going to say, this is what the family's doing at dinner. And so dads are taking it and they're changing too. But I don't talk to the dads about it as much. I talk to their wives.
That's phenomenal.
Right.
I love that. All right.
Can I just say, it only takes like 5 days, 7 days. This is not like a forever thing. I'm not
within a week, you should notice a difference. What you're saying? If that's the issue, you'll notice a difference in a week. If you don't notice a difference in a week, then it's something else.
Right. Then I didn't hurt you because you took a vitamin.
What's the worst that can happen? Yeah. Exactly. So what's the most common mistake people are making trying to self-treat long COVID symptoms with supplements, do you think?
Gosh,
long COVID has become ubiquitous. So what's
right? I mean, I think maybe I'm going to be less judgmental about, not that you were judgmental, but like I think that everyone is doing the best they can, and I think most people don't understand the mechanism of what's going on the way that maybe myself and some of my friends do. So I think that both physicians and people are doing the best they can. They're just trying things, or they don't know that there's anything that could help. So I think maybe the biggest mistake would be is that they don't have access, this isn't really their fault, to someone who understands what's going on. And those of us who do, I think, are just starting to say it louder and louder. And, I, for instance, I've been speaking about this topic at the conferences that I speak at for about 2.5 years, maybe 3 years now, maybe almost 3 years, 2.5. So now I have providers come back crying to tell me about all the lives that they changed using these things. But, it's so easy. And so I think maybe just we're not there yet. We're in the middle of an evolution. And so
I think people are throwing things at themselves, trying to fix, they don't know what. I think, the next question, which is about, where do you think mainstream medicine is missing the signal? Is it the mitochondria, the neurotransmitter, the immune shifts, the microbiome? It sounds to me like it's all of it.
Yes.
Like they're just not looking at it.
And again, like, not their fault.
And not because they don't want to.
I know.
We're gonna say this once here. Like, nobody's blaming anybody. No. Like, your conventional allopathic doctor is doing the best that they humanly can with what they've got. I think that what's happening is that we have a new set of the landscape has changed dramatically.
Yes.
And we need new lenses, new optics, new approaches to really help people.
Yes.
And the good news is that people like you and your friends you've made progress in this area. And you'll probably, if I interview you in another year, you'll be like, oh my God, Nat, you'll never believe we also figured out blah, blah. Like something
it's every
else.
Week. Yes.
It'll keep evolving. And to me, you said something earlier that it's the hallmark of the doctor who who doesn't stay stuck in their paradigm, which is it wasn't working, or I realized I got that wrong, or, being willing to continually learn and be wrong and build and evolve. I would say, guys, when you're working with a medical provider, you want someone who's treating you and everything else like a Rubik's Cube, right? Yeah. If I flip all the things this way, I'm going to line this row. Yeah. What falls into place? It's, and I think that the conventional system doesn't allow for that time and space to think. Yeah, and that's where you moved into your model.
Right. And I think you nailed it there with time and space. What I want to say about the MDs I know, it's the system that trained us, and they don't have time. Like, I spend an hour with every patient. I think like Gen Peds, they get like 11 minutes or something. You can't even know. So I think these are really good docs who have demands on them. They don't even have the time to think. So, and I think maybe time is probably our most valuable, just like period, as humans.
What's your minimal effective data set for someone who's post-COVID and not bouncing back?
I'm sorry, what do you mean by data set? I want to make sure I understand.
Well, so what are the metrics you need to see? Like, you have someone in front of you who's post-COVID, they're just not bouncing back. Yeah. What's the minimum amount of information that you need to see from them? I mean, it sounds like just from a symptomatic perspective, that's going to twig you to say, let's try this.
Right.
Are there labs that you like to see? Let's say that doesn't work. Yeah. Are there certain labs you want to see that give you more insight?
Yeah. So I tend to be testing light, clinically heavy, because if I that's sense. Right, there aren't really good, like this, as this field evolves, there aren't great tests for a lot of this. Like, how do you really look at mitochondrial health? Like, they're all expensive. Like, you and I could talk about that for 2 hours, right? So it's really more about like, well, back to the thing about what's the minimal thing. If they say to me, I'm not as happy, energetic, quick, so it's things like brain fog, I'm tired. It's all the things that we think of with long haulers. I'm passing out. I'm not getting up for work, whatever. So that story for me in this setting, meaning in this, I was going to say post-COVID world, but you and I spoke before.
In the world we're in.
Right. Yeah. In this world. And everyone lives in this world, right? Then I'm going to guess that might be it. And I'm going to try a few things. I have some tricks for, like, if you can't get a bed in the morning, and then I have some, and we try a few things. And then once we figure out what works for that patient, that got them standing again so that they can get back to their life. And then I have to go handle COVID. And then that's like a really big topic, and you'll be having Robin on. And so she can talk about that too. But so I don't usually send tests for what you're describing. I send tests if I don't know what to do, but the easiest way I know what to do is to try the things that worked on the other patients before them. And if that doesn't work, then I try something else. And usually we get it right. Yeah.
Yeah. So it sounds to me like there's also work afoot to kind of chase the bug out.
Yes. No, yes. And yes.
And we don't have to talk about that if that's not in your wheelhouse. We've got lots of things in your wheelhouse, but
I mean, I like,
that's encouraging.
Yes. Yes. I mean, and Robin can talk to you about V9, which is a supplement that she works, that's a bunch of polyphenols that helps remove spike protein. And her data is really exciting and interesting. I get overwhelmed at the thought of like needing to go through a very, intense protocol to remove something that I know the next time you go to Safeway is going to be again. And so, and so like, I'm really, I know, I shop at Safeway. So that's why I say it, but and thank God there's people like Robin and the people that are doing her work, right? Because they're going to solve the problem. And meanwhile, like that's overwhelming for me. And I get paralyzed by the thought of that. Like, I have to clean everything up and keep it cleaned up. I'm just going to we got work to do. I'm just going to
well, it feels to me like someday some protocol could be a quarterly clearance.
Yes.
And in between replenishing those nutrients that are robbing us for when you get re-exposed, I think down the road, it won't be overwhelming at all.
Yeah. Because we'll know.
we'll know, we'll have clarity, and we'll have strategies to do it.
Yeah.
But okay. So in the meantime, you've linked this work to outcomes like we've talked about this, depression and anxiety. So, and I think we've already talked, the question was, what's your model of what's happening biologically? We've already talked about this. It's a depletion of the cofactors and the uptake of tryptophan that's affecting the catecholamines.
Yes.
And that whole process. So for someone who's listening to this, who's hearing this.
Yeah. I have ideas.
Would you suggest? Yeah. Tell them what to do.
Yeah. So like, why not, even if you're not sure you're grouchy, you could either ask your spouse or you could just try, like so many people say to me, like, I didn't realize that I thought I was just tired, and run down, because without epinephrine and norepinephrine, you're fatigued, right? So, you don't have zest, you don't have, verve, right? So, and there's no like checkbox for how's your verve, right?
How's your get up and go every morning?
And people just think like, oh, it's the holidays. Oh, my kid went to college. Oh, whatever. So, I think really everyone could try this, and it's fun. Like there's so much that's not fun about COVID. It's like trying things and seeing what happens is kind of fun. So you can before I created anything, we just had people do this, and this is easy. Ready? So tryptophan, L-tryptophan comes as usually 500 milligram capsules. Yep. So if you would just take 3 of those all at once, and I could go into the science about, for me, why it needs to be all at once, but it competes with other things at a transporter into the blood-brain barrier, and it's about that ratio. So I'd rather you take them, if you can, all at once rather than throughout the day. And do that for 3 to 5 days and see if something has changed. And the reason I don't make everyone try everything all at, like the cofactors too, is because I can't get a lot of men to buy in. But if they feel a little better in a few days, I can usually get them to take the other ones. So then
you have street cred.
Yes, right. Exactly. No, that's true. Because now they're like, wait, what? Then if you take a B complex it has to have P5P and methylfolate. I don't care which one. Sometimes it really matters to me, like what brand you use. Like this is everybody needs this. So get one of those and get zinc. I don't care, 25 milligrams, something like that. Do one of each of those a day with the tryptophan. And I don't care if you give them all at the same time, what time of day. Oh yeah, people are always like, oh, the tryptophan is going to make me sleepy. No, like just because you eat that, okay, that's not true about Thanksgiving, right? That's sugar. You're eating too many carbs, right?
Well, you're eating too much food, period. Right. You're going into a food coma.
Exactly. And we do make melatonin from serotonin, but not just because there's food around. We make it, but we release it in response to diurnal, right? So you're not going to make people sleepy during the day. I don't care what time you give it. So, and then I just say, if you noticed anything, like to make it simple now, I say just try the tryptophan for a week. If you're up for trying all 3, try all 3 for a week. If at a week you think I changed something, give yourself a full 2 weeks. Then you can stop. I'm all about like less is more. But we have now over time seen that the same people keep getting repleted, and they call me back and they're like, I'm depressed. I'm like, do you remember like a year ago we did this? And they're like, oh shoot. And they do it and it fixes it. So we've done that so many times that now I think maybe because people go to Safeway, like maybe 5 to 7 days a month, why don't you just take the nutrients? You see,
interesting. Because you're not suggesting people do this on an ongoing basis.
No,
you're suggesting they do it 5 to 7 days, like the first week of every month.
That's right. Yeah, days 1 through 7 or something. Or if that's too hard, do Saturdays and Sundays or just Saturdays. I don't care some, because it's not like I need to get you way up here. I just need you not to be down here. And so the reason, if we do it every 5 or 7 days a month, like you get here, let's say, and then when you get exposed, you're coming to here, you're not coming to here. That's what I'm looking for.
Until you get depleted. And so is there anyone who shouldn't use tryptophan or these nutrients? Is there anyone for who this is contraindicated?
That is a great question. So in short, people worry about things like serotonin syndrome. So like, let's say someone's on an SSRI, which makes serotonin stick around longer. If that was started when they did have serotonin, I don't think you're going to give them, actually, I'm just going to make this simple because that's going to get really complex. I think maybe if you're on an SSRI, meaning, something that modulates serotonin, then maybe talk to your doc before taking tryptophan. That's like way overkill.
Probably it's fine, but you should talk to your doctor.
That's right. Okay. Or if you take it and you get all jacked up that day, you're like, jittery hot, you feel like your heart is racing, just don't do it anymore. But, and I would say someone who is suicidal, should not change their moods without the support of someone. So, like there's a black box warning on, let's say like Prozac, that it can, create the ability to kill yourself because you get, when you're depressed, it's not just your mood, right? It's all like, so I can give you the energy to do things again before.
Act on the thing.
Yeah. So if you are personally going to do this and you're already actively suicidal, why don't you get help before you take tryptophan? But, I don't think it would have been the tryptophan's fault, if that makes sense. So it's
no, but to say, so anyone on an SSRI or someone who is already having suicidal ideation,
that's right.
Suicidal, you could think about this, but do it with someone, with your provider.
That's right.
Okay, great. Yeah. Now you've given people the recipe. They can just go out to Safeway or wherever, or Designs for Health or Full Script and get their nutrients.
Right.
But you also decided probably, you know what, I think we've now talked to you long enough to know that you are a woman who is looking for solutions and to provide easy solutions to people. So you did go ahead and create your own product.
I did. And I'm so sorry. Can I go back and say one more person that shouldn't take it? I just realized.
As many as you want.
Okay, thanks. Is that someone who, the tryptophan thing, like the more I understand about tryptophan, the more complex it is. I way simplified it down, right? Because most of the tryptophan in the body is actually used by the liver to make NAD and ATP. And right. And
which is going to make you tired and depressed, by the way, if you don't have enough of that.
Right. And in the pathway of that, you make kynurenine and other things that can actually cause more inflammation and that. Also, the immune system makes a receptor for tryptophan when you're infected that then further perpetuates that. So it's way more complex. But but the punchline there is, like, for instance, Betsy gets really worried if I want to give people tryptophan because she sees mostly, or in this setting, she's worried about mitochondria in really sick people. So really sick people, it's not about replacing depletion yet. Like, you should handle the really sick part, right? So if you're, totally not functioning, needing, plasmapheresis and stuff, like, that's the wrong person. And because you will feel worse, because if I give you tryptophan, you're going to use it, and because there's actually 5 steels, like the liver and the immune system. And so everyone will start to use it, and you might make more kynurenine and quinolonic acid, and those can be inflammatory for the brain. So it's not like tryptophan's fault. It's just that the immune system or the body was trying to do something and it was depleted of tryptophan. And if you give it back, it can do more of that. So if
make you feel worse, that's right. You feel better.
So if you're super sick, we're talking about like repletion, right? After. Right. And so, but if you take it, this is like also diagnostic, right? So if you take my supplement and on day 1, you're like, no, what is she talking about? I don't feel good. Guess what? That was the cheapest diagnostic tool ever. You need to go find a real doctor, right? Because, like someone who knows what they're doing about, not about tryptophan, but about COVID, because by definition, I now know that your mitochondria are in trouble and you need to find someone who knows how to help you with that.
It's like tryptophan is fueling a system that can't function to begin with.
That's right.
Like it's trying to fuel a broken system.
That's exactly right. And it gave it the fuel.
Yeah.
Right? So I would say, the body is so smart. This is how I do what I do, is I trust each person's body to tell me what they need. So we try something. I tell the patient, what to look for, what to tell me about. They feed back to me. Then we learn something. So if you take
so interesting
tryptophan and you think I lit a fire, you need tryptophan really badly, but not right now. You need to go.
The order of operations question,
right.
which what's interesting to me is, and I mean, this is a very loaded question we can't possibly answer here, but so many people are on anti-anxiety and antidepressant meds now. And if we could go back in time and look at how many of those people came onto those meds since that Big C event, and because, and how many could have been fixed or helped, not fixed.
Or can be.
Can be helped.
Right.
But they're already on the SSRIs. And so, you know what I mean? Like see, I get overwhelmed by that because I sit there and go, wow, like if we could just unravel a little bit and start over with some of these people, and doesn't mean they can't be helped now, but I'm just saying that, some of these people become attached or they believe this is the thing. But, the tragedy is very often these medications don't work long-term and they're not addressing the problem. Right. They're still deficient.
Right. Because it won't work well. What an SSRI is, so it's a selective serotonin reuptake inhibitor. It says to the neuron, just like wait 2 more seconds or nanoseconds before you
don't pick it up yet.
Right. Yeah. So, but if you don't have enough tryptophan, you don't have enough serotonin. If you don't have enough B6, you don't have enough epinephrine, norepinephrine, dopamine, right? So you can do whatever you want about the uptake, but there's not enough. Like that girl, I kept changing her meds and it wasn't working. I gave her tryptophan and we took everything off.
That's a bunch.
So you're right. Those meds don't work well enough. They did work to get her out of suicidality, which is, I think, why people are taking them. But, it's nutrition. Like, it's food. It's so much easier. Yeah. So, yeah. Okay. Can I tell you about my supplement now that I took us off topic?
Yeah. Tell me about the supplement, because then I want to talk about infant microbiomes.
Okay, then I'll be fast. Okay, so here's the deal. Remember I said that thing that I was going to frame. So I figured out that over time, the more and more trace nutrients were getting depleted, and I was figuring out something else. And the immune system can't calm itself down now. You're getting mast cell issues, all that stuff. So I then was tired of having to solve the next problem. I said, you know what? I'm going to put everything in one place. And I came up with it and I tried to give it away because I'm so busy, right? I'm like so busy. And I don't think I did a good enough job expressing the importance of this, what looks like not very exciting supplement, right? So, it sat there for about 9 months. And then people are asking me about it because I'm teaching, and I'm like, this supplement's going to come out. It'll just be so much easier because it's got all the little things. Because then I'm like, you should do these things. Oh, and this other thing and this other thing. And people were listening to me talk like, what the heck? So anyway, I came up with it and I gifted it. And I don't think I did a good enough job explaining it. So after 9 months or whatever, I said, okay, wait, I just got to make this. People are getting upset with me. Okay, well, note to self, I should really stick with the recipe and the doctoring, the whole, finding a manufacturer. Do you know how many lawyers I had to get to make sure I wasn't going to lose my tush? Just it not my superpower. Anyway, I'm not sure I would do it again, but I absolutely am glad that I did now. It was a labor of love, but it is created. And in fact, so you do not have to use mine. Like I said that before, you can use the recipe I just gave you for most of it. This works better. So this is everything that you need.
Everything you need.
That's right. My friend Leonard that we spoke of earlier, who put on that really awesome convention or conference, New BioAge carries it, and I carry it myself. And so you can go to my website.
We're going to go back to this. I promise you it'll be in the show notes, and you'll be able to, you guys, for those of you who want to get your hands on this stuff, and remember, it's a 5 to 7 day a month supplement. Yeah. This is not something you're going to take in perpetuity. So, and it'll either be helpful or not be helpful.
And it might be diagnostic.
Exactly. And could be diagnostic. So as a pediatrician, you would have thoughts and insights on the infant microbiome changes and where you think we might be headed for trouble. You're warning about this, that it's shifted over the last 25 years. Yeah. Interesting. My son was born 25 years ago. What do you feel has changed, and why does it matter for health span decades?
Yes. It matters for everything. So I've been practicing since 99. So whatever that is now, 25 years-ish. And at the beginning of my career, most of the kids were fine and they had good skin and they didn't all have asthma and eczema and they could eat most foods, right? But there was a few families, right? Like my tough families. I don't mean that emotionally I mean medically complex, right? Autoimmune, and those moms, I was often having to take milk out of their diet because the milk protein was getting through the breast milk and upsetting their stomachs and their skin was like sloughing or, whatever. They had eczema. But it was just a few, right? And all the other docs said I was crazy. And then so I would take it out and they would do fine, right? Then fast forward, it started to be like more and more foods. Now I was having to take out like milk, soy, nuts, eggs, shellfish, right. But then when I would do that, the infant's gut would heal and then we could put them back in. So these are kids that went on to eat whatever they wanted because I allowed their gut to heal. What has happened over time is that without help, I don't think they heal. And I think that the long drain has probably been glyphosate. We're about 3 generations in now. And, while glyphosate might not actually kill human cells, it decimates microbes. And it decimates specifically microbes that we absolutely need. And, so that's fine. Where do we get our microbes, right? Infants are sterile. They come out, they go, right? And they suck in mom's vaginal and rectal microbiome and we kiss them and we sneeze on them and, we start to populate them. Right. Yeah. And, lactoferrin and breast milk help us educate them, like all of it. It's so beautiful. Right. But so 3 generations ago without glyphosate, that microbiome was fine. Right. Next generation, not as fine because mom doesn't have as much because she's been exposed. And then it just goes on. And now it is catastrophic. And I would say even the families over the last 10 years, even pre-COVID, who I would say to them, you're normal. Like, we're not going to have to take food out of your diet. And then one of them was ending up with, actual frank colitis from being fed, like normal kids. Now I know how to fix it. So I fix it. So that's fine. But I thought to myself, this is a problem and people don't get it. And Leonard and I were just talking about this, that I would make the case that the long drain has been glyphosate, like the kindling, right? But then the gas was COVID because COVID decimates, and like this could go into a bigger talk, but our short chain fatty acid producing bacteria, for instance, in our colon are required for successful life, I think. And so, and COVID specifically decimates those. And so, and in infants, the kind of bacteria that they need, like bifidobacter and lactobacillus and stuff, that is also being decimated, both by the long thing and the short attack. And so now, I don't know what everyone else is going to do. And I'm really worried. That's very concerning to me. So that's partly why I teach about gut.
Yeah. So what can we do? Like, should we be thinking about repleting some of these microbes in infant guts?
Right. So maybe, I think, and this is again a bigger topic than for here, but maybe I don't have the most popular agreed response to. I'm not sure. Well, when we give probiotics, for instance, they don't actually take up shop. Right. Yeah. So like you're using them a little bit more as a modulator, but I don't think people understand that. Right. So, right. It's a tourist. It goes in there, it spends some money, which fluffs
it doesn't set up shop. No. Yeah. It doesn't immigrate.
Right. So I think if you know what you're doing, you can, that can be useful in some settings. But, when I first looked into probiotics, way back, I did a deep dive because we were using it forever. Like in infants, I would use it. But then I looked in the peds literature and it is like 50-50. Some kids have more asthma, some kids have less asthma with it. And I thought like years and years and years. And I was like, what the heck? Well, I think it depends on, who else is in the gut. It's not simple. And so what I usually use, but this might be outside the scope of what like you need to find a functional medicine doc. That's what I want to say. Yeah. If you could find a naturopath or a functional medicine doc before you're pregnant to optimize your gut health, then that would be great. In fact, we're starting a program. I think I'm so witty. Are you ready for this? We're calling it preconceived, which is where we take couples a year before birth, right? Because I couldn't take all the babies in the world, but I needed to do something. So we're doing that. We talk about trauma. You got to get rid of your own trauma. First, we do microbiome, we do toxin, and it's for the men and the women, because you would be shocked that the exercise, for instance, in the mom pre-pregnancy changes the metabolic health of the infant.
Wow.
As they become an adult. So anyway, I think that's really the solution, is that we're going to have to clean up our gut. Oh, I'm sorry. The WIT is that my tagline for my company, I'm just mostly trying to make myself, or this program, laugh all the time, is a new position on baby making. And I just think I'm so dang witty, and I made mugs and I'm giving them out to OBs and mostly right? It's you have to sit with it just for a second as a pediatrician. Anyway, so I think that's the real solution. I think we have to fix the microbiomes of the women.
Of the parents.
Right.
Yeah.
Before. But then, what do we do? Otherwise, I think if you have a good functional medicine doc, if you have a doc who listens to Leonard and the other places where we teach, I use things like butyrate. So I cheat. Mm-hmm. I use butyrate, which is a short chain fatty acid made by happy bacteria that make our colon happy, make our brain happy, make our immune system modulated and calm. It's most of the food for our gut. It makes themselves happy, sets up good shop. So since these people don't have good microbiome to make those, I cheat.
Give them a postbiotic.
Yeah. And then I wait. And other things, there's peptides and there's other things, but I would say, do whatever works for you. But I think it's not I can't give as easy an answer for this as I could for the depletion.
But I think the short answer is that if for infants, we may need to intervene on the microbiome of an infant, whereas in the past we would have said not so much.
That's right.
And that's one. And you need to find someone knowledgeable who can help you with that. And then the second one is, if you have the luxury of time, and you don't accidentally become pregnant, then invest 6 months to a year in optimizing your own self before you're growing a new baby, because that environment you're growing the baby in is going to have everything to do with that child's outcome.
And of those, microbiome would be first. Of all that, detoxify and all of that. And, I one thing that I want to say that's really interesting is that, those of us like me used to know it mattered to the child's microbiome whether or not mom got antibiotics, intrapart, during delivery, and whether or not the baby was breastfed, and whether or not it was C-section or vaginal, right? So this is real. Finally, Western medicine is caught up and they talk about that, but it doesn't even matter anymore. That truly those were important when the baseline was okay. I could see a difference in those kids, right? Now it doesn't matter. All of it matters, but it doesn't change the way the child's microbiome looks.
I think it might explain also a lot of what we're seeing in kids.
Absolutely.
I mean, it's I don't know. It's almost hard to find a child that's not being diagnosed with some kind of issue,
right?
Whether it's ADD, ADHD, right. So I think something's happening to change the way those children's brains are working,
right?
And it's got to start there. And I think the microbiome is got to be the place to start for sure.
Right.
So if you had 5 minutes with every pediatrician in North America, what would you beg them to do differently?
Listen, take time. And that's not, they don't have that luxury, I understand, but it's important.
No.
Celebrate the child for who they are. This is it. It's one thing. It takes one non-parental adult to make a child resilient. Remember, we talked about my childhood for a second. Why do I end up like this and other kids end up some other way? I had a dance teacher, she actually just passed recently, who took me under her wing. We would choreograph musicals together, and she made me feel valuable. It takes one non-parental adult. Well, guess what? Every pediatrician has that. And you know what? You can be that, and everyone can be that. But that pediatrician meets that kid at least once a year.
You said that care and love are among the most effective medicines.
Yes.
How do you operationalize that in a clinic without turning it into some kind of fluffy thing?
Yeah. Well, okay. So love sometimes doesn't have to be fluffy. Sometimes it's tough love. You know, love is presence, time. You know, you have to be present. You have to
give time,
right? And we should all do that in everything we do, right? At the grocery store, I'm present. I'm not sure I'm in love with the grocery checker, but I do have love for other humans, right?
Yeah.
And it just, and so I think maybe that's how you make it operational. Also, my clinic, the people I work with, we clearly love each other and they love our patients. And so that is when you walk in, it's kind of like cheers, like Norm, because we have couches and we have coffee and tea and, parents of kids who are chronically ill or adults who are chronically ill, right? Because we do adults too. This is a place of comfort for them. And what I knew is that they give love to each other. You want to know the smartest people on the planet. It's the moms of kids with autism, right? For instance, they're like mycelium, right? They're networked. So put a bunch of those people on a bunch of couches. Healing happens. That's love.
So you've created an environment.
Yeah.
What's the most common way that modern families accidentally train nervous system dysregulation into their kids? And how do we help them to unwind it?
We have missed out on boredom.
I love that.
Period.
Yeah.
Right. Because when boredom is when we, it's when the magic happens, right? It's when we create. And if we're constantly, if kids are constantly stimulated, that's not good for the nervous system. They don't know how to regulate. They don't know how to be okay, right? Their cup has to be full, right?
Yeah.
So I think, and that's not their fault. That is society. Like I'm not pointing fingers. This is a bigger issue than those parents, for instance. But I would say that if I had one piece of advice for everyone, it's teach your children how to be bored, what to do with boredom, right?
Yeah. And I think that feeds into a conversation I had, I think it was last year, with the Dr. Robert Melillo, where he sounds the alarm on screens for young children. Because we're losing boredom because there's no space for it anymore, because there's no age too young for a child to be in front of a screen. And I'm not saying this from a judgmental perspective.
Right.
There's no judgment. I get the world we're in. And we've been given what seems to be the perfect tool to keep a child occupied at an airport, in a restaurant, like wherever the case may be. And I think that it's rewiring children's brains in ways that
absolutely
we can't even imagine. And we're going to see it, but ways that we can't imagine.
Right.
So, we're going to close down now, and I'm going to ask you kind of a dark question.
I'm ready.
We're going to push in the light. Are you worried about the human race, do you think?
I'm going to cry again. So
we're coming back into the light, though.
Yeah,
so I want to say,
I am. I got really depressed for a while when I was working on that conference, because the more I realized the impact of COVID on the microbiome, that bacteriophage thing, and really who I am is different because there's COVID in it. Just even identity, right? Me and them and us, right? And I had this sense that this might be the time to burn it all down and just start over.
You said that.
And actually, but then I realized the impact I was having on my staff and my family. And I realized that wasn't helpful. And so, I decided, well, okay, fine.
Well, we need you.
Yeah, I'm pretty good at this.
Keller. You're kind of good at what you do. Yeah. So, but what's the thing you think is is the most at risk? Is it the immune imprinting, the microbiome shifts, the neuroinflammation, fertility? Is it something else you think that's most at risk?
Yep. So those are all linked, right? Like, I don't know if you've heard Betsy and Abid and I speak, and we, and Robin.
Well, it's all affecting everything.
That's right.
Like,
we all fight about who's
related.
most important. I'm the gut, and, or Abid says it's all about the heart, like, so we have this little
cardiovascular
joke, right?
system.
Exactly.
Yeah.
But of course they're all linked. But I would say, probably it's the gut. Okay, it goes right, affecting the immune system. And now we talk about self and not self, right? So I think autoimmunity, and we're just getting more and more brittle, like, and there's less and less life to us, and nutrients are getting depleted, not just from the loss there, but like, from inflammation, right? And I used to have a handful of patients like that. And now I think it's going to be everyone. And that's scary.
So what's the call to responsibility for clinicians over the next 5 to 10 years? Because we're not ending this on a dark note. There's too much light.
Yeah.
There's way too much light. There's way too much hope. Look at everything you've already figured out.
Right. Yeah, we'll be fine.
Right?
We'll be fine.
So what's the call to, like, if a clinician is listening to this right now, what's the call to them over the next 5 to 10 years? And frankly, what can they start in their clinic next week?
Yeah. So the call to them, I don't even need to make, because it used to be just those patients were showing in my clinic, right? But
they're showing up there.
They're showing up there. So it is so ubiquitous now. Unlike before, where like my autoimmune patients or my PANDAS patients or my chronic Lyme patients who were called crazy or malingering, or it's all in their head. Those physicians that used to say that about my patients are now saying things like, there's this thing that can happen after infection where there's like an immune dysregulation ongoing. You're like, okay. Yeah. So I think the call has been made, and COVID has actually been great for my patients, because suddenly, well, A, I had already tuned them all up, so they were fine. And B, because they had chronic health stuff, I had to already write them.
Right.
So they did fine with COVID. And the call has been made. So they are showing up in their clinics, and they're having to solve things that they can't solve, and they're going to have to go outside.
Yeah.
So
I think
like,
the
it's
call
happening.
is to go outside.
Yeah.
What you think and start looking for answers elsewhere. Like,
yes,
at these little events that are happening.
That's right.
So let's give people hope here.
Yeah.
What do we need to change to feel optimistic again? We're
not alone.
Yeah.
Right. And I treat chronic Lyme, right? And I realized that it was like 5,000 something years ago. There was a mummy that they found recently. He didn't find, and he had spirochetes in his joints, and he had tattoos over his joints that they were using as acupuncture. And he died at 41, I think it was, of a stab wound to the back. So sit with me here for a second. I thought Lyme was beating up my patients. And then I realized we evolved with Lyme. And guess what?
Yes.
Like, we had industrial revolutions. We created art. Like, we civilizations. We made the typewriter. I don't know, like all of that with Lyme. So guess what? That's why I got to a place of like, well, okay, I wonder what we'll do with this. And, I think existence finds a way. Yeah. And I think I really don't know what's going to happen next, but maybe COVID was important. Like my patients with chronic Lyme, and they would be sad, the kids, because they'd be out of school, and I'd have to give them all these meds, and they were missing out. And I would say to them, like, I know, like, we can pout and whine today, but then let's put our big girl pants on. And I promise, when the zombie apocalypse comes, you're going to be fine, because you're all tuned up. Well, they were. Yeah. Right? I wasn't actually meaning that we would have this apocalypse, but we did. But guess what? I can't even know. All I can do is show up. So I think we should show up. I think we should do what we can. What is that? Like, change the wisdom or the courage to change the things I can, or help me with
and
that.
The wisdom to accept the things I can.
Yeah, whatever. Yeah. That one. So do what you can. Stop fretting about what you can't, and, show up.
Yeah. No, absolutely. And listen, we've figured out so much. So it's been 10 minutes since this COVID thing showed up, right? And we've already come a long way. Yeah. So I think that as long as we stay open and stay curious,
yes,
people like you, we are gifted with in this world, will continue to find solutions. You and Betsy and Robin
and you,
all the people. Well, yes. I'm just sitting here trying to shine lights in the corners to make sure that people like you get seen and heard. So, all right, we're going to finish with 4 rapid fire questions, and then we're going to tell people where to find your stuff. One test you think is overused?
Microbiome.
The most boring intervention that works embarrassingly well?
Love.
The question you wish patients asked you on day 1?
That the patient can ask whatever they want. Yeah. What the doctor should do is listen.
Yeah.
And I usually ask the patient, if I had a magic wand, what 3 things do you want? Because I don't know. I know what I think I want to fix for them, but maybe it's that they want to be able to bend over and put their shoes on. And that's way more important than the acne all over their face. So I can't know, and so it's easier for me to get the acne on their face better or whatever. If they're already able to be mobile in the way they wanted, which I thought wasn't as big a deal, maybe. Yeah.
Maybe that's what's important to them. 100%. Yeah. Dr. Cynthia Keller, I knew this was going to be a fascinating conversation. It's taken us on a beautiful journey.
Yes.
Thank you for your time. Please let people know where they can find you, where they can find your magic supplement. I think you even created a code that people can use to buy it.
I did.
Which I think is really cool. So for people who are wanting to explore if this replenishment supplement can be with the thing that turns the lights on in a different way, where do they go? And then where do they go to learn more about you?
Right. Okay. So first I'll talk about the supplement. It's, my company, I'm so pleased with the name, is Alchemic Medicinals. So,
Alchemic. How do we spell that?
ALCHEMIC.
I see. Yeah.
Medicinals, medicinals.com. And the supplement is called Tryptophan Regenesis. And
love it.
And it's the only thing on that website. So it comes in capsules and the powder is about to ship. So the capsules you can get at alchemicmedicinals.com, or you can get it from Leonard at New BioAge, right?
Okay.
And both of us mostly sell it to providers. So my hope would be is that you saw a provider who had heard me speak and could help you with this. But if not, you can get that from either him or me. And then the powder is just at mine, kids, I needed to create something that kids could also have, but also it's 5 pills a day now. And that is a lot for adults. So, and it tastes pretty good. I mean, it's not, it was hard to make tryptophan taste good, but it does ish mostly. And, and that you can get from my site only. And that's the one we made a code for. And the promo code is NATROCKS. So NATROCKS. And
thank you.
Yeah, thank you. And I honestly did not want to be a salesman. I just want to get this thing out there. So we're going to offer 50% off on the powder, since I can't offer that on something that other providers sell, and because that's not fair, right? But I can do it on the thing that only I have. And so I have 500, my first 500 powder shipping to my warehouse yesterday. And so until all 500 are gone, your people can have this code, and I hope they can get their family members better and their friends better. And yeah.
Thank you. Well, I will have to see how fast we can push this episode out, but we'll do our best. Now, where else can people go to learn more about Dr. Cynthia Keller and your work?
That's a great question. So I used to try to fly under the radar, right? Because I was doing weird stuff and really upsets
anymore,
people. Not now. Yeah. I know. I'm a member of Longevity Docs, and I speak for them. I'm on scientific board for New BioAge that we've talked about with Leonard. So I teach through him. I occasionally get invited other places, but my clinic is centered in wellness. And, we weren't taking new patients really for 11 years, but we have found some ways. I do occasionally doc-to-doc consults. And also, if there's a patient I think I could fix easily and I don't think anyone else can fix it, fix is the wrong word, but
help.
Help.
Yeah.
And it's one of my things. And I'm like, this would be easy for me. But it's hard to teach someone else how to do that. We'll sometimes take them on for 6 months. I can't have another lifetime relationship because I'm I'm full, right? But I can do that. And so we've done that some. Yeah.
Well, you're definitely going to have to start that doc to doc.
Yeah, no, I do that. Actually, that's one of my biggest passions, right? Because it's sowing seeds. I'm making new gardeners.
Yeah, for sure. You can only be one gardener. All right. So centeredwellness.com.
Yeah, that's right.
And for the powder, it's alchemic
medicinals.
Medicinal.com.
Medicinals, yeah.
Medicinals. And Nat Rocks will get you 50% off the powder for as long as you have some left. Okay. Amazing. Thank you so much.
Thank you.
This has been a beautiful conversation. Yeah. I so appreciate it.
Yeah, it was really fun. And I'm grateful for the work that you do.